regards to expanding clinical AI at Jefferson, I think it's important for us as radiologists to continually advocate for the growth and progress that we've been have with incorporating AI. A lot of other subspecialties are still in their early goings when using AI, and they have a lot to learn. I'm a little biased, but I would say that radiology is one of the more technologically advanced subspecialties within medicine. And since we've done AI for quite a bit now, and it's been a part of our field for quite a while, there's a lot of lessons to be learned and shared with our colleagues. So when I think about leadership and expanding AI across a hospital, I do think that radiologists should be in the driver's seat, or at least one of the drivers when it comes to incorporating AI. Because we understand that there is a lot of potential mishaps and hurdles that need to be crossed before it's appropriately integrated when it comes to security, the performance of these solutions, and I can go on and on. But I will always attest to the fact that radiologists should be in the room when it comes to deploying enterprise-wide clinical AI. I would say that the care coordination mobile app has revolutionized our workflow. And understandably so, everyone's PERT workflow can look a little bit different, namely our pulmonary embolism response team, and who is the primary interventionalist and who are the necessary playmakers that need to be part of the coordination of care. So for us, our interventional radiologists drive this workflow. They ultimately decide which ones end up going to treatment, and we'll then reach out accordingly to our critical care team and our ED department as to how the patient should be appropriately triaged. And what the CareCo mobile app allows us to do is allow them to have this information at their fingertips so they can start delegating and appropriately contacting the necessary powers that be in order to make sure that the patient gets onto the table as soon as possible. The mobile app has the necessary labs as well as the imaging, which allows them to navigate the imaging and to determine the degree of pulmonary emboli burden to see if they actually warrant intervention. And I've heard time and time again from our radiologists or our IR doctors who are on call that having this tool and allowing them to have a sneak peek on potential interventions that would require them to go to the hospital, that advanced notification allows them to mitigate a lot of the time necessary to then get that patient onto the table. In fact, that's one of the outcomes that we're exploring. We're investigating the amount of time that we were able to reduce from time to intervention. And if I subjectively ask some of our IR docs today, some would say that that time has been nearly cut in half. But of course, we are looking into those numbers and aim to publish something to that effect. When I think about where I see AI proving its ROI the most, I think it would have to be opportunistic screening. Now, it's gained a lot of buzz as of late, and rightfully so. What opportunistic screening refers to is the detection of imaging findings that would otherwise go undetected on routine outpatient imaging or even in the ER setting. A prime example of this, which has gotten quite popular, is coronary artery calcium detection. This refers to the calcium burden in the heart. And if the patient is flagged to have a high enough burden, that may signify a potential health risk for some sort of myocardial infarction or heart attack. So these patients are flagged and can be appropriately routed to cardiology for treatment. And some of the treatment outcomes that they may occur include medication management, some sort of procedure such as CABG or catheterization. Now, these are all examples of episodes that we've seen occur in our retrospective analyses. Now, Aidoc has taken this a bit further as they developed this NLP, natural language processing tool, that helps them curate a list of patients that have said findings, and they can appropriately look at the EMR and determine if they've previously been seen by cardiology. So now they're able to generate a nice curated list for the cardiology department to utilize and then bring back the appropriate patients. Now, in regards to what opportunistic screening brings, I think the ROI is pretty self-explanatory. These are all examples of where there's a positive benefit given to the healthcare system and their subspecialties, as well as, most importantly, the patient. The patient now has the information they need to take action and get the appropriate care that they deserve.